Thank you, Leslie Hayes and Hayes & Associates, for all of your wonderful assistance for this afternoon's program. We're now going to turn our attention, after looking at the global epidemic, to right here at home. We talked earlier about how 600,000 people have died of AIDS in America, and that every 9.5 minutes a new person is infected. There's been an AIDS amnesia right here in the United States, but that's changed last year with the establishment of President Obama's National HIV/AIDS Strategy. To talk about that and the Affordable Care Act, the importance of healthcare reform legislation to people living with HIV/AIDS, we have with us today Melody Barnes. Melody is a gifted leader and lawyer. She is the President's top domestic policy advisor in her role as the director of the White House Domestic Policy Council. In this position, she coordinates the domestic policy making process in the White House, supervises the execution of national policies, and represents the President's policies to the United States Congress. Critical issues under her purview include that development and implementation of the strategy, as well as healthcare reform. Before joining the White House, Melody Barnes served as the Executive Vice President for Policy at the Center for American Progress, and from 1995 to 2003, she was Chief Counsel to Senator Edward Kennedy on the Senate Judiciary Committee here in the halls of Congress. And it's a very emotional day for all of us here because this is the Kennedy Caucus Room. And last year, we showed a video of Senator Kennedy saying that he hoped one day amfAR would serve and mean victory over HIV/AIDS. Well, throughout her career, Melody Barnes has been a champion of civil rights, women's health, religious liberties, and a leader in the fight against AIDS. So I'm very proud to introduce you to an extraordinary woman and a gifted leader, Melody Barnes.
Thank you so much, Susan, for that introduction. And I have to say, as a speaker, I am thrilled that I am after the cookie and coffee break and not standing between you and the cookie and the coffee break. I also want to take a second to introduce someone that I'm sure many of you in this room have worked with and many of you know, and that's Jeff Crowley, who's the Director of the Office of National AIDS Policy at the White House. And Jeff is a wonderful colleague. I am thrilled to join you today, and as Susan said, to join you in the Kennedy Caucus Room and to be with amfAR, the Foundation for AIDS Research, for today's event. amfAR, as many of you already know, is one of our most trusted partners and collaborators as we deal with this issue. And before I get started, I do want to say a few other thank yous. First of all, I want to acknowledge a true hero, and that is a person who will be honored in her death, but honored later on this afternoon, and that's Elizabeth Taylor. And I think that President Clinton said it so well after she passed on, that her work and her legacy will be remembered in the lives of those who are now living a better life and a longer life, and because she has inspired so many of us to continue the work. So I have to acknowledge her. And then I also want to acknowledge CEO Kevin Frost, who serves as a member of the President's Advisory Council on HIV/AIDS, and he has provided such strong leadership to us in the White House on global HIV issues, as well as the work that we're doing domestically, including addressing the critical work of HIV issues affecting gay and bisexual men around the globe. As we make historic progress on LGBT issues here in the United States, we cannot lose sight of how far we also have to go in the United States, but also how deeply marginalized the LGBT community is in many countries around the world, and how disproportionately impacted they are by HIV, even in places where we normally think the epidemic is being primarily comprised of heterosexuals. So I applaud Kevin and amfAR for their work. Chris Collins, who's the Vice President of Public Policy, has been a strong and consistent partner with us and a leader in the Coalition for National HIV/AIDS Strategy. And he's been a real source of support for Jeff and for the ONAP office in the White House with HHS and other federal partners. We also have to say that because of his work, we believe we've been able to more effectively start to implement our national AIDS strategy. He has been a wonderful leader in terms of convening meetings and expert consultations on the most technical of issues, but ensuring that we can use our public resources in the most transformative way possible. And then finally, I have to acknowledge Susan for her work. And Dr. Susan Blumenthal, who's a friend, but also a longtime advocate for people living with HIV, going back to her days as Assistant Surgeon General and Deputy Assistant Secretary for Women's Health, she has a track record that I'm sure every single person in this room knows about. She has proven her commitment to these issues, and not only her commitment, but brought her expertise and her talent and her energy to these issues, and really, I think, brought to the forefront the importance of addressing issues of women when it comes to HIV. And as we press forward in the White House, women and addressing the issues that face women will be of key importance to us. As Susan said, this afternoon I want to talk about HIV/AIDS in America, and specifically the tools that we've been able to deploy in the Obama administration to focus on prevention and care for everyone, regardless of sexual orientation or race or ethnicity or gender or a whole range of other factors. A year ago, President Obama took actions that have and will continue to change the lives of those living with HIV. He released the nation's first, the very first, comprehensive plan for responding to HIV here at home, our national HIV/AIDS strategy. And I have to say that was a commitment, a promise he made during the campaign, and last year we were able to fulfill that commitment. And at the same time, he also fought for, pressed forward on, and was able to sign into law the Affordable Care Act to expand health security for all Americans while making our health system more effective and more efficient. Our teams at the Departments of Health and Human Services, Treasury, and Labor have really been working around the clock. And that is not a hyperbolic statement. I can tell you we are all pressing extremely hard. So they have been working night and day to implement the Affordable Care Act and to make sure that among the beneficiaries of this law will be people who are living with HIV/AIDS. For those living with HIV, we're already moving in the right direction, and I just want to give you a few examples. Last year, the administration delivered a one-time $250 rebate to people in the Medicare coverage gap that is commonly known as the donut hole. As you know, we're working to phase out this gap completely, and in the interim, starting at the beginning of this year, the law provides a 50% discount on brand name drugs and other discounts for generic drugs until the donut hole is completely phased out. From our monitoring of this issue, we know that people living with HIV have been among the largest groups taking advantage of this benefit. The Affordable Care Act also included a policy known as ADAP as true out-of-pocket, or TROOP, and that went into effect at the beginning of this year. In short, state AIDS drug assistance programs, or ADAPs, will now be able to provide temporary help for Medicare beneficiaries with HIV in the coverage gap, or the donut hole, and Medicare will step in to provide coverage once an individual's drug cost exceeds the coverage gap and they reach the catastrophic level of coverage. This is an important action that's going to relieve some of the pressure on state ADAP programs and benefit people with HIV. Additionally, the pre-existing condition insurance program, or what we call PSIP, is now available in every single state in the country. It permits individuals who have been denied insurance coverage on the basis of a pre-existing condition and who are uninsured, have been uninsured for 6 months, to purchase private insurance coverage. While monthly premiums vary, this is an important potential source of insurance coverage for people who are living with HIV, and it provides a bridge until all of the insurance expansions go into effect in the year 2014. And then finally, in 2014, the expansion of Medicaid to all Americans with incomes below 133% of poverty will greatly expand access to insurance coverage for people living with HIV. And those with income above that level will be able to buy private insurance coverage through the exchange and will be protected from discrimination on the basis of HIV status or other pre-existing conditions. Those changes in the law will go a long, long way to bolstering our insurance system and strengthening the safety net for those who are living with this disease. The Affordable Care Act also provides a foundation to make improvements in access to care so we have a good chance to improve health outcomes for people living with HIV. That's going to allow us to capitalize on the existing and exciting research results that we all celebrated earlier this year, including the study showing that early access to antiretroviral therapy can lead to a 96% reduction in HIV transmission. But as we take important steps forward, we are sobered by the fact that so much progress remains to be made. Only 19% of people living with HIV in the United States are fully virally suppressed. That means that even though the science has shown us the way, the science has shown us how to protect people living with HIV and has given us a powerful asset to prevent new infections, we still have a lot of work ahead that we must do so that we can utilize these tools. To do this, we have to ensure that those living in the United States who don't know their HIV status, that's approximately 20% of those with the virus, are linked into care, are maintained in care, are able to establish a supportive relationship with a qualified medical provider, are offered antiretroviral therapy when clinically indicated, are given access to the best available medications, and are supported in adhering to their medications so they remain healthy and so that all new infections are rare. Making new infections rare and ensuring that all people are provided with high-quality, life-extending care, free from stigma and discrimination, is the vision that's animating our national AIDS strategy. One of the most challenging problems facing us is the state waiting list for the AIDS drug assistance programs, for the ADAPs. More than 8,600 people are currently on waiting lists in 13 states. This is, without question, a serious challenge that requires a unified response. Ultimately, the Affordable Care Act provides a long-term solution that will take the pressure off the state ADAP program in 2014. But while we know there's a long-term program out there waiting for us, that's not enough. We have to figure out how to bridge the gap between now and then. The President is committed to providing federal leadership on this issue, but we cannot do this alone. Federal support for ADAPs and other parts of the HIV care response in this country have grown more rapidly than state funding over the course of the program and over the time that this President has been in office. We have supported increase for ADAP in every budget enacted since this President came to office. Last summer, Secretary Sebelius took urgent action to respond to ADAP waiting lists by using emergency powers to transfer $25 million from other HHS programs to provide supplemental support for about 30 state ADAP programs. This was a one-time action, but because the challenges have only grown worse over the last year, the administration amended its budget request for the current year, and as everyone knows, in a very, very difficult fiscal year, in a very, very difficult budget fight, during which many health programs saw deep cuts in funding, we increased ADAP by $50 million over the enacted level from just a year earlier. I want you to think about that for a minute. CDC was cut by $740 million. NIH, SAMHSA, and other parts of HRSA saw modest cuts in funding. But because of the President's commitment, because of his determination to work to address this issue, we increased federal support for ADAPs by $50 million to the level of $885 million. Because of the scope of the challenge, however, this does not solve the problem. We call on states to maintain and increase their funding for ADAPs, and we thank the pharmaceutical companies who have expanded their pharmacy assistance programs to help individuals living with HIV who cannot access ADAP. These stakeholders are a critical part of the solution to this problem. As the President and Secretary Sebelius and other federal partners exhibit strong leadership in the battle for increased federal financial support for ADAPs, we've also undertaken important federal-level policies that are going to help move us down the field. Making ADAP count as true out-of-pocket for Medicare beneficiaries takes some of the pressure off of ADAPs, as I mentioned before. Providing a 50% discount on brand-name drugs in the donut hole also helps take pressure off of ADAPs. Giving people with HIV access to PSIPs, or pre-existing condition insurance programs, also takes the pressure off of ADAPs. Moreover, in June of this year, the Centers for Medicare and Medicaid Services, or CMS, issued a state Medicaid director letter that called for the national HIV/AIDS strategy, that it was called for in the strategy, and in which many HIV advocacy organizations had pushed us to deliver. It informed states of many coverage options available to state Medicaid programs to assist people living with HIV. Collectively, these various policy initiatives and funding increases provide a clear demonstration of the President's commitment to fighting to improve access to health care, including prescription drug coverage for people living with HIV. The National HIV/AIDS Strategy builds on the coverage expansions and quality improvements embedded in the Affordable Care Act, so we have a clear roadmap to save and enhance lives. We believe, and many of you in this room and outside of this room have told us that you agree, that the national strategy is a big deal. And over the past year, several actions have been taken by the White House and by federal agencies to implement it. Here are three notable characteristics of our first year of effort. First, we've reinvigorated the federal response to the domestic HIV epidemic. The federal government has exhibited a renewed commitment to working with various stakeholders to respond to this epidemic. At HHS, the Assistant Secretary for Health, Dr. Howard Koh, has begun convening senior leaders from across the government on a quarterly basis to improve coordination. As recommended in the strategy, diverse government agencies have become engaged in the implementation effort. For example, the White House has hosted meetings on such topics as responding to HIV among women and girls and implementation of the strategy in Latino communities. HHS has conducted numerous consultations on diverse topics, such as re-engaging the LGBT community and how to work with state and local governments in developing state and local implementation plans. The Department of Labor held a meeting on expanding employment opportunities for people living with HIV, and the Department of Justice has prioritized HIV discrimination in its civil rights enforcement. Second, we prioritize funding for critical HIV research services. In July 2010, we announced $30 million in new HIV prevention investments from the Prevention and Public Health Fund. And that's allowed the administration to support targeted new investments for priority activities. For example, we launched a 3-year 12 cities project in the 12 metropolitan areas with the highest HIV prevalence and which are responsible for 44% of AIDS cases in the United States. That initiative tests these new approaches to integrated resource planning for HIV prevention and care, and ensures that investments are prioritizing these interventions that have been shown to reduce the number of new HIV infections at a community level. CDC and HHS are applying lessons learned in this initiative to all of their programs with other state and local health departments. Additionally, CDC is making new investments to support prevention among gay and bisexual men, the population that we know is most affected by the HIV epidemic in the United States. CDC is also making expanded investments in HIV surveillance so that all states and local jurisdictions have the capacity to track at the local level viral load. That means that viral load of all identified HIV-positive individuals in a community, which is an effective tool for us to understanding how the virus might be moving and how things are changing, HIV infections are changing in a community. As I mentioned earlier, in the FY 2011 continuing resolution, we were able to increase funding for the ADAP programs by $50 million, and we increased HIV prevention funding at CDC by $31 million. That was a significant achievement because, as I also mentioned, the agency had received a $740 million funding cut. The administration was also successful at pushing back on policy riders that would have prevented federal and DC funds from being used for syringe exchange programs, and we know what the benefits of these programs are and how particularly effective they can be. And also, we want to thank, again, amfAR for its leadership in working with us on those efforts. The VA, I also have to mention, received an increase in investments in HIV care into the FY 2011 budget. Third and finally, we are beginning to make painful but necessary policy changes. We are putting in place a number of policy changes that we believe will maximize the impact of public investment. For example, CDC and HUD have committed to update funding formulas to award resources on the basis of living HIV/AIDS cases instead of allocating funds on cumulative AIDS cases. This means that we're awarding funding based on the most current data available, data that shows how the epidemic is distributed across the country. On June 30th, CDC released their new funding announcement for state and local health departments using the new formula beginning in January 2012. This has raised consternation from some and support from others, and CDC has responded to feedback from states and others who have asked questions to make sure this transition is as smooth as possible. As with any change that leads to shifts in funding, this will be a painful transition for some. We acknowledge that. We understand that. But we believe that it's necessary if, in fact, we are going to understand and achieve the strategy's objectives. Implementing the strategy is an ongoing process, and our actions over the coming year will be critical. We will continue to leverage the many policy improvements of the Affordable Care Act, and we know that it's vital that we engage with the HIV community. All of the success we've had to date has been because of our collaboration with many of you in this room and those who are in communities across the country. I know I've covered a lot of ground. I wanted to give you a sense of what we've been working on for the past 2 years. But let me close by saying that I and my colleagues in the Obama administration, Jeff, all of us at departments and agencies, and the President are deeply, deeply grateful for all of the support that we are receiving from amfAR and from the broader HIV community. Despite the numerous serious challenges that the President faces every day, I can tell you, and Jeff can tell you, that this is an issue that he is deeply concerned about and that he is determined to do something about, that he is determined to move the ball significantly down the field to achieve the goals that all of us want, that all of us in this room have been working for, and to ultimately ensure what Chris Collins has called the end game for the HIV epidemic in the United States and around the world. Thank you so much for all you do, and thank you for being such great partners.